So my name is Keesandra Agenor, and I will be doing a presentation on cultural competency in the Haitian-Serving community. So just to go over a little bit what we're going to go through today, we're going to start talking about cultural competency. What does that mean exactly, and why is it important? And then we'll jump into Haitian culture. So what is cultural competency? It's the ability to effectively use cultural knowledge and skills in cross-cultural encounters. So what if you lack that cultural knowledge, not because you don't care to know or understand the people from the community you serve, but simply because you happen to be from a different culture, share a different background, have different beliefs, or never been exposed to the common practice of those people? Well, if that's the case, then you're in for a treat today, because I'm here to tell you that cultural competency is not something that's innate to any one of us. Just like effective history taking, a proper physical exam, or troubleshooting through a difficult airway is a skill that is acquired through special attention and practice. Just keep in mind that no matter how many patients you treat from one cultural group, you may never fully understand every aspect of that culture, but it's worth a try. So why is it important? When it comes to cultural competency in medicine, it's a major contributor to the health of the immigrant population. As we know it, cultural incompatibilities result in poor access to healthcare. Many systems try to address this issue by hiring more providers from a particular cultural group to address the needs of a specific community. However, the qualities that patients most desire in physicians is not nationality, but accessibility, linguistic proficiency, and the ability to treat them as individuals within their own cultural context. That being said, increasing cultural competence among healthcare providers can effectively address many barriers to adequate healthcare, including mistrust of the healthcare system, unfamiliarity with the culture, and also stereotypes. So when looking at Haitian culture, we can start right here in Flatbush. Haitians comprise one of the largest ethnic minority groups of Flatbush. With greater than 500,000 Haitian immigrants in the US, that is more immigrants than any other Caribbean country. And if you count the individuals who were not only born in Haiti, but the individuals who report themselves as having Haitian ancestry, you have a total of more than 1.2 million diaspora in the US. Despite this, data on barriers to healthcare and health outcomes of Haitian immigrants are very limited. In 2018, the US Census Bureau looked at the distribution of Haitian immigrants across the US, and 2 states were found to be home to nearly 70% of Haitians. The 2 states being Florida with 50% and New York with 20%. The counties that had the greatest number of Haitians were Miami-Dade County, Broward County, and Palm Beach County, all in Florida, and the fourth one being Kings County, New York. Together, these 4 counties comprise of about 43% of the total Haitian immigrant population in the United States. To understand why there are so many Haitian refugees and immigrants is to understand the background of the land called Haiti, or the Republic of Haiti. Geographically, Haiti lies in the western 1/3 of the island of Hispaniola in the Caribbean West Indies, and Haiti shares the same island as the Dominican Republic. Haiti is a very mountainous and densely populated country with a total of about 11.5 million people as of 2021, according to the UN. Yet despite this, it has the lowest per capita income in the Western Hemisphere, with about $1,200 US per person per year. There are currently 60% of Haitians living under the poverty line and 25% in extreme poverty, living off of less than $1 US per day, with a little above 2% of Haitians in the higher class. With a little above 2% of Haitians in the higher class holding government positions and holding on to about 40% of the wealth of the country, and the remainder belong to the middle class, which tend to work in other positions, but tend to also be very well educated with decent jobs and good salaries. A lot of the poverty in Haiti is contributed to overpopulation, high unemployment rate, high illiteracy rate of about 40%, and also political instability and fragility. So let's go a little bit further back and see how this came about. Back in 1492, Christopher Columbus arrived on the island, later called the Hispaniola, and formed a Spanish colony at the time. A lot of the individuals who were living in the country at the time were called the Arawak and the Taino people. They were enslaved at the time, and many of them died within a few years due to starvation, harsh treatments from enslavement, and European diseases. Later on, the Spaniards later took in about over 500,000 African slaves to replace the indigenous people that later died. Later on, the French showed interest in Haiti. After the Spanish basically obliterated most of the gold mines in Haiti at the time, they relinquished Haiti to the care of the French. The French Revolution came about in the 1700s. At that time, Haiti basically composed of about 500,000 African slaves, 30,000 European colonists, and about 25,000 Afranchis. Afranchis were mostly free mulattoes, were people that are mixed of African descent and European descent. They aspired at the time to be at the same economic and social levels of Europeans, but many of them could never really achieve that, but they did become slave owners at times and also own land. Toussaint Louverture was a freed slave who wanted freedom for everyone. There was many revolts during that time, during the French Revolution and the Haitian Revolution, but his revolt was the one that was actually successful in 1798. During that time, after the slaves were freed at the time, a lot of Afranchis decided to leave the country. So the affluent Haitian population dwindled. A lot of them moved to the States, France, specifically New York, LA, and Miami. Later on, Jean-Jacques Dessalines, which was a lieutenant under Louverture, continued the fight, and he later was able to win the fight that led to Haiti become the first independent Black republic. At the time, they were granted complete freedom, but in 1825, the French decided to change back and not recognize the independence of Haiti. At that point, they asked that Haiti pay back $21 million US dollars to France for the lost slaves and land that they lost due to the freedom that was given. Either that or there would be another war. Haiti at the time decided to pay that debt. So over the years, they've been indebted to France. There was long periods of instability, frequent regime changes, and near anarchy. Then in 1915, the US came into Haiti in order to protect a lot of the Americans that were in the country at the time. In 1957, US supported French Duvalier to become the next president. His name is also known as Papa Doc. During that time, in 1957, there was a reign of violence and terror in Haiti. He established a notorious secret police force called the Totomacoutes, which effectively terrorized the population through killings and disappearances. When he stepped down in 1971, he named his son Jean-Claude Baby Doc as his successor. During this reign of terror, a lot of Haitians fled the country. Many were Haitian students and professionals who resettled in the US, Mexico, Puerto Rico, France, and other Caribbean islands. Other Haitians who did not have access to funds sought refuge in the US via boats, most of them directed to the Florida border. Over 23,000 Haitian people were found at sea at that time. Only 11 were granted asylum between 1981 and 1990. Many of them died, and the rest were sent back to Haiti. Baby Doc was forced to leave Haiti around 1986 after many protests and riots. And then Aristide, a former Roman Catholic priest in Haiti, was democratically elected as president in 1991. And he became known as the president of the poor. He was said to be corrupt after a couple of years, and then there was a coup d'etat where the US eventually became involved again and took him back into the presidency. And eventually he left again into exile in Africa. Since then, there's been lots of natural disasters in Haiti, including the earthquake in 2010 that resulted in 250,000 people dying and $11.5 billion of destruction. And then, as we know, the most recent tragedy was the assassination of President Jovenel Moïse in July 7th of 2021, leaving the country in a period of unrest with violent protests and a surge in kidnappings in the country. So despite the turmoil-ridden history of Haiti, most Haitians are proud of their heritage and prefer to be distinguished as either Haitians or Haitian American. Despite this, many Haitian Americans tend to fall through the cracks when it comes to data collection for demographic sheets or research studies, with most studies comparing Black and white individuals, failing to capture the Haitian community as a distinct group for their own culture and history. With the majority of Haitians being descendants of African slaves, a majority will self-identify as being part of the Black race. However, when it comes to ethnicity, many older Haitians will select other, whereas younger Haitian Americans will self-identify as either Black or African American. When it comes to the language and communication of the country, French and Haitian are the official languages of Haiti, with both having a written form. But don't be surprised if your patients tend to speak Spanish, which is a common third language taught in schools, thanks to their close neighbors, the Dominican Republic, and also English as well. When it comes to oral communication with your patients will tend to have very formal ways of addressing you as madame, monsieur, or even doctor. Most patients will tend to be quiet or reserved with healthcare providers out of respect, and they will more likely nod out of respect, not because they actually understand what you're saying. So you just may have to clarify that. It is very common when it comes to discussions with acquaintances and family members for Haitians to speak more loudly than what is customary in American culture. And due to this, sometimes they can be easily misinterpreted as being aggressive or agitated. When it comes to written language, the official documents in Haiti are written in French. And with a lot of, due to the fact that French is the primary language that's taught in schools. However, due to the high illiteracy rate of about 40% of the country, don't assume your patients can read the documents simply because you provided it in their preferred language of Haitian Creole or French. And don't assume at the same time that patients are illiterate due to the high illiteracy rate of the country. There are many professionals from Haiti as well who immigrated to the US. When it comes to nonverbal communication, it's very common for patients to greet their families and friends with kisses. And then as far as with formal greetings, it'll be most likely a handshake. There are certain things that are found to be rude in Haitian culture, rude gestures, including like entering a room without greeting all the individuals in the room, or finger pointing. Especially keep this in mind for all patients that come from languages, from countries that don't primarily speak English, especially when they don't understand why you're finger pointing, that can come across as being rude. Also, prolonged eye contact with elders as well can be considered rude as well. When it comes to time orientation, tardiness tends to be very common. So if you're referring your patients to the clinic, just stress them that it's important that they show up on time or sometimes earlier due to a long waiting time. When it comes to some of the common phrases in Creole, I just want to go through a few of them. You might hear a patient say bonjour, which just means good morning, bonsoir, which means good night or goodbye. When it comes to, if you see a patient, you're trying to identify who they are, you can ask them comment ou, which just basically means what are you called or what's your name? And the patient may say, just state their name, or they may say Malele and say their name afterwards. When it comes to asking how are you doing or what's going on, you can say comment ou. And at that time, the patient may very well respond muy bien, which means I'm completely fine. But in the case of the ER, that's not usually the case. So some of the phrases that you may hear is muy pas sentim bien, which means I'm not feeling well. This is when a patient just feels like they might have a brief illness that they may easily recover from, that doesn't really restrict them from the activities of daily living. And then you have patients who will say muy malade en pile, which means I'm very, very sick. This is when they're severely ill. And then of course they can say muy pas refait, which means I will never be well again. It may sound like a very drastic way of describing it, but when they say something like that, it means that they feel like death is imminent and they may have like a fatal illness. One of the things I just wanted to mention is this common phrase, just like moi gagne douleur sans la poitrine versus estomac. A lot of patients, they will look at when you ask about chest pain, a lot of patients might not know what the formal word for chest is, which tends to be poitrine. So sometimes when you ask the interpreter to interpret that, the patient might not understand what the interpreter is asking. So you can also ask, do you have pain in your stomach, which is more of a common way of asking about chest pain. And then of course, oui, which means yes, no, which means no, and then merci, which means thank you, which is things that you might hear when a patient's leaving. When it comes to family traditions, elders are highly respected, and children that don't respect their elders are basically told that they'll have mass misfortune in the future if they don't respect their elders. So they look to them a lot for a lot of medical decision-making and a lot of other advice. Children are expected to excel academically, and don't be surprised as corporal punishment is a common thing in Haitian cultures. And a lot of parents may also feel concerned about negative effects of American culture on child rearing. When it comes to intimate partner violence, in theory, it can be higher due to increased stressors of immigration, like unemployment, language acquisition. However, it may very well be underreported due to fears of disrupting their children's homes, having financial hardship, or fear of deportation for some patients who don't have legal status. Despite this, even though in many Haitian households in Haiti, single parent homes are not as common, but here in the US, it may be common due to the fact that a lot of patients may come here looking for to the US for economic opportunities. So at this time, one partner will be left in Haiti until the financial stability is acquired here in the United States. So a lot of these family members will usually seek advice from family members that are in the United States, but if that's not possible, they'll tend to try to live in ethnic enclaves like Flatbush, where there's a lot of cultural and emotional support systems there. So it's important for you to ask your patients, Like who do they ask or seek advice from when it comes to medical decision making? And then herbal remedies is very common. They're usually passed down from generations, and a lot of times they're used prior to seeking medical care. So it's important for you to ask your patients if they've taken anything specifically to treat the elements. And that's more than just Tylenol and ibuprofen, but any kind of herbal remedies. When it comes to religion and spirituality, it plays a central role in the life of many Haitians, especially when facing an illness. With about 80% of Haitians identify as being Catholic or 15% being Protestant, a lot of them believe in miracles. So sometimes that can delay seeking of treatment because they're waiting for miraculous healing. So just keep that into consideration. And one of the common phrases that patients will say in response to a diagnosis or to a treatment plan is like "Si bon Dieu veut," which means God's will be done. And there are some patients who do practice voodoo in Haiti. And with voodoo, there's a lot of belief that there are spirits that can cause illness, but a lot of patients might not be very forthcoming with this information due to the fact that there's many negative images and stereotypes in the United States in regards to zombies and pin-encrusted dolls. So a lot of patients will keep this and will not share this information. And just because a patient is Christian doesn't necessarily mean that they do not partake in voodoo practices. So you can ask them if there was any ceremonies or anything in specific, if they do say that they've done like voodoo practices in the past. So when it comes to the concept of health, there are different causes when it comes, and specifically to the cause of illness. Only a small group of Haitians from the higher middle class have access to the most basic healthcare, like clean water, immunizations, antibiotics, and well-resourced hospitals. And these patients tend to have a better understanding of the lay perspective of the scientific basic of illness. However, most Haitians will think that illnesses are from natural causes outside the body, like cold, heat, wind, and many of them will seek advice from herbalists or non-traditional doctors who don't tend to typically ask many questions prior to treatment. As a result, when you ask your patients about what's going on with them to the ED, a lot of times they may have very vague descriptions of illness or location of pain. You may ask them what's going on and they'll say like they have problems breathing, they may have chest pain, nausea, vomiting. But if you ask them more detailed questions, they may be reluctant to answer because they're not really sure why you're asking those questions. So it's good to clarify that with your patients. When you think about interventions that you're giving, you have to understand some patients, when they get something as simple as oxygen supplementation, which can commonly be given via EMS before arrival to the ED, when their interpretation of what that oxygen supplementation can mean to them could be basically serious condition. A lot of patients are not used to getting oxygen. So when they do get oxygen, they might think that they may have a fatal illness. So it's very important for you to clarify why they're getting the oxygen. And a lot of times patients may also consider injections as working faster than pills. So they may request that over pills. When it comes to chronic illnesses, a lot of patients, since they don't have direct access to healthcare in Haiti and rely on traditional treatments, they may very well not understand what a chronic illness means exactly. A lot of times, if you give a patient high blood pressure medication for high blood pressure like amlodipine or hydrochlorothiazide, or give them metformin for diabetes, they will start the medication and be very thankful for it. But once the prescription runs out, they'll think they don't need it anymore. Not because they don't want to be compliant, but because they don't understand the chronicity of the illness. So be sure to clarify that. And when it comes to preventive care, a lot of patients from the Haitian community will look at preventive care as being eating well, like being very plump, and don't understand the thought that obesity may be causing some of the illness they may have. And a lot of the things they will do is that they'll try to maintain equilibrium with certain things that they eat in order to maintain their health, and also do things like enemas and give that to children as well as to pregnant women. So just keep that into consideration. When it comes to diet and nutrition, the typical Haitian meal consists of various vegetables that may not be very common here, like okra, watercress. In addition to that, the starches are a very big part of meals, including rice, yam, yuca, and plantains, and various types of meats as well. Usually the men will choose the meal of the day in typical Haitian culture and get the largest portion of meat as well. A lot of Haitians will veer away from eating certain foods like yogurt, cottage cheese, runny egg yolks, or raw food, which is not very common in Haiti, usually due to like low amount of people in Haiti having access to electricity. So they tend to eat foods that can be kept well at room temperature. When it comes to hospital food, don't be surprised if your patient just may refuse the food that's there. A lot of times they won't eat foods that they're not really accustomed to due to fears that the food may actually make them sick. So patients might decide to fast while they're in the ED or even admitted upstairs, unless their family members bring them certain things like teas and soups from outside. When it comes to screening and vaccinations, just keep in mind that there's a lot of mistrust in healthcare providers, whether it be because of mistrust of the government in Haiti and healthcare systems out there, but also it can be from the fact that there's been a lot of early interaction in the US that have led to that mistrust. When a lot of the Haitians came in the 1980s, like I mentioned before, during the reign of terror, that was the same time where HIV/AIDS was discovered in the United States. And a lot of Haitians were blamed for bringing the virus to the States. This was later disproven, but there were many Americans, including healthcare providers, that viewed being Haitian as a risk factor for HIV. Even the CDC at the time had prohibited blood donations from anyone of Haitian origin. So just keep this in mind when asking a patient about HIV screening, just to clarify and let them know why you're recommending it for whatever reason. When it comes to access to services, like I mentioned before, it's a small amount of people in Haiti who tend to have access to healthcare services in Haiti. So you may have to describe to them what exactly that means as well. And when it comes to communication, especially when it comes to discharge planning, before you give patient written info, you should consider the fact that, like I mentioned before, there is a high illiteracy rate of about 40%. So ask the patient what's the best way they would like to get that information. Always try to describe to them verbally with an interpreter as well if they require one. But the most important thing when it comes to managing healthcare with Haitians is particularly forming personal relationships, because they're very essential. So connecting with care management or patient advocates are important as well. When it comes to sexuality and reproduction, more so homosexuality, it's not usually accepted or talked about very commonly in a Haitian household. So even if a family member may know of an openly gay individual, they may deny knowing that. And that can very well prevent a lot of homosexual patients or patients in general from the LGBTQ community from disclosing their sexual orientation due to fears of bringing shame to their family or being maltreated or physically harmed. When it comes to birth control, it's not something that's commonly used due to the fact that a lot of patients think that children are gifts from God, so they usually will feel shame in asking for birth control or using it. Abortion is not very common in Haiti as well, due to the fact that it's due to religion concerns, the fact that it could be a sin, and also the fact that it's illegal there as well. When it comes to pregnancy, a lot of patients will, once they're done giving birth, breastfeeding is very common, as you'll see in the pediatric ER. But a lot of patients, what you'll see is that some of them have become more accustomed to bottle feeding in America to allow the mother to work outside the home. When it comes to death and dying, patients will grieve in different ways. So many patients can be very silent in grieving in their grieving process. A lot of them may be very animated and loud, like I mentioned before, but just allow them that time to process whatever's going on. And more specifically, a lot of patients will seek prognosis when you're telling them about a diagnosis. A lot of times they don't know about these chronic illnesses. They don't know what it means when you give them a diagnosis. So a lot of them will ask, like, what exactly will that mean going forward? Like, will they be able to outlive this illness or not? And then specifically autopsy, a lot of patients don't really know what that means because it's not a common thing in Haiti. So you just want to keep that in mind with your patients when you're offering that to them. And then zombification is sort of a practice that's done in the voodoo religion. And a lot of times patients may ask to see the physical body of the dead person in the ER because they want to confirm the person's actually dead. Because sometimes with zombification, what will happen is that someone will be treated with like a neurotoxin, and then they'll usually get buried alive, basically, and then get removed from the grave within 8 hours. And it's said that their souls are overtaken by whoever zombified them. So patients would like to see the dead body and confirm and have actual confirmation that the patient died. So when it comes to ASAP's statement on cultural wellness and emergency care in the ED, they believe that quality healthcare is not only dependent on scientific competence of the physician, but also their cultural awareness. And it's also an essential part in the training of physicians as well. In addition to that, it's important that we encourage all our patients to communicate their cultural issues that may impact their care, regardless of whether or not you think you understand their culture completely. As well, research should be made available to emergency departments as well in order so that we can communicate with our patients effectively and respond to needs that they have. Also avoid explicit biases. Just a quick overview, and this is like cultural competency in the AD in general, outside of the Haitian culture. It's a skill that helps us understand our patient's background so we better understand where they're coming from. Help to address their specific needs. So when you have a patient, a lot of times you must consider the people's history, like a lack of trust in their government, the healthcare system, and how that may influence the way they look at you and impact their care. And just recognize that communication is more than words. So nonverbal communication is very important for you, especially when you're using an interpreter, because that can leave a lasting impact on the personal relationship you have with that patient, and it may also result in them avoiding interactions with the healthcare system in the future. When it comes to family traditions, don't hesitate to ask who is important in the decision-making process, especially during discussions involving goals of care. When it comes to religion, you can always offer the services of our chaplain, especially for certain patients who are Roman Catholic, who follow certain sacraments. They may want to go through the anointing of the sick or confession if the patient, if you're withdrawing care or the patient's being made DNR, DNI. A lot of your patients, when it comes to council of health, they think of, they tend to seek care from they can seek care from herbal doctors or seek advice from family members when it comes to illnesses. So just keep in mind that they may not understand exactly what chronic illness is. So make sure you ask them, what does that mean to them? And be very clear as to the importance of following up with a primary care doctor. When it comes to diet and nutrition, don't be afraid to ask your patients when was their last meal or what did it consist of, especially when it comes to our new onset diabetic patients who are not in TK and we're sending them home with metformin. It's important that we clarify, their understanding of what is not appropriate, what is considered a high carb diet. When it comes to screening and vaccinations, when offering a screening test or vaccination, like HIV or tetanus, ask the patient, have they ever had it before? And do they understand what it's for, what the vaccine is for? There's a lot of patients who will nod and they may not necessarily understand what you're saying. And there are other patients who are very reluctant because they don't trust the healthcare system, so they may require more clarification. When it comes to sexuality, you definitely don't be afraid to ask, do you have sex with males, females, or both? If you don't ask, a lot of times, depending on the culture the patients come from, they won't tell. So it's very important for LGBTQ patients who may not disclose their sexual orientation due to fears of harm or judgment. And when it comes to death and dying, patients will brief in different ways. So don't be afraid to use the family room to allow them to brief in whichever way is appropriate for them. And that's basically it. So thank you. I want to say special thanks to Drs. Christoph, Verback, Kendall, Labadera, Sim, and Warshaw, who assisted me with this presentation.